Hi guys, I'm Amanda Taylor. I'm going to be giving you a brief persuasive speech on why you should get your children vaccinated. All right, the vaccines will protect your child and other children as well. Vaccines should be compulsory. All right, let's go. How many of you have been vaccinated as a child? Was any of you not vaccinated as a child? I'm going to give you some reasons and what vaccines you should get as a child, okay, guys? I did some research on vaccines, and so we're going to give you some good topics on it. All right, vaccines are of great importance because of all the reasons I'm about to tell you. The National Vaccine Program Office states that vaccines are important for three big reasons. All right, vaccines are stated to protect your child from diseases that can harm or kill them. Vaccines are stated to protect others from that disease that your child might infect others with if you're not vaccinated, okay? There is no reason why you shouldn't get this because they are completely safe and effective. The U.S. Department of the Health Services breaks up the vaccines into a process into three definitions. Vaccines are the weakened organisms/diseases used to create immunity to that organism to the disease. Vaccines are then injected into that patient. Okay, so these are 7 vaccines that you should get as a child. It's going to be the measles, mumps, rubella, your tetanus vaccine, polio, the diphtheria, and the pertussis. Most states also require the varicella, the hepatitis B, and the meningococcal. Okay, College of Physicians of Philadelphia states that currently the United States requires a child to be vaccinated for the required state diseases before entering school systems. However, 47 states allow for religious exemptions of 18 states allowed for personal exemptions, okay? So personal exemptions, if you just don't want your child to be vaccinated, some states will allow it. Usually they go through a process of going to court and getting that signed by the judge. And then you would have to present that to the school, to the daycare, or to any state nationwide place that recommends it. You will actually present that as your shot record, saying that you defer your child being vaccinated. All right. So vaccines protect your child from life-threatening diseases that can permanently harm or kill your child. Vaccines saves over 9 million lives a year. This number can be another 16 million if we vaccinate at all times to prevent these diseases. Immunizations reduce the risk of harmful diseases. According to the UNICEF, smallpox have been eradicated, saves 5 million lives annually, and polio is close to being eradicated. Looking broader, vaccines protect your child if they get sick. Some people say, well, if your child is vaccinated, then what are you worried if my child gets sick? We got a little topic there, okay? So if a non-vaccinated child gets the disease, it increases the likelihood of the vaccinated child getting the disease. If everyone would just vaccinate their child from that disease, it would eradicate because of the vaccinated child isn't going to develop the disease, only catch it from a non-vaccinated child. So let's just break it down, just in case you don't understand that. If you get your child vaccinated against a disease, your child cannot develop that disease unless it is exposed to a child that has not got that vaccine to fight against it. Your child can easily get it if they're around another child who hasn't got vaccine with that disease. okay? Unvaccinated children are 35 times more likely to get that disease that is preventable than the vaccinated child. So it's just very important just to get your child vaccinated. And into my case, my baby is 13 months, okay? My oldest is 6 years old. My 6 year old got his vaccines. He he became a little weird when he got his flu vaccines. And so I was hesitant on getting my baby his flu shot. So, and then again, I recommend ladies, moms, mothers, it doesn't matter. If you're going to get your babies vaccinated, do your research. They might become reactive towards that vaccine. So my baby, I gave him a half dose of the flu vaccine because I saw how my oldest reacted to the vaccine. He had a little fever for about a week. And so usually the hospital recommends your child around 6 months to be vaccinated. So usually they tell you once they relieve from the hospital that your child need to be vaccinated. No, not true. Not true. If you actually speak with your doctor or the pediatrician, they recommend your child to be vaccinated around 6 months. And I think I did that on my informative briefing, just to wait about 6 months. When your baby's that young, just keep them away from anyone that's sick, sneezing, coughing. Keep them away. They don't need to be out in the public, my opinion. So any child that's 6 months or older, they're okay to get vaccinated. And it's okay if you want to take your time and getting them vaccinated. You can wait every 2 to 3 weeks if you feel like it's too much for the child, because it can be. Okay. So let's go into, there's no reason not to get your child vaccinated other than medical reasons, because they are effective and they are safe. Just do your research. All right, as before, vaccines are 90% effective in protecting a person from a disease. This is better than being completely vulnerable. It is extremely rare for a vaccinated child to develop the disease they are vaccinated from if they are not exposed to it. So just keep in mind, okay? So the CDC has done extensive research that shows that most commonly safety concerns about the vaccines are false. So have you heard that myth that vaccines gives your child or has become in your child autism? So I did some research on the CDC. It shows that there is no link between the vaccines and autism whatsoever. Okay, the original report states that there was a link written by a researcher who violated the scientific ethnic codes by changing his results to match what he wanted to see. Fainting during those vaccines is another safety concern. People think that it means that the vaccines are harmful. Okay, so after receiving the vaccines, it is due to the process of receiving the vaccination, not the vaccine itself. Only 3% of people faint due to the vaccines, okay? So it's just because that they're afraid of needles. So we're going to sum this up just stating that vaccines are safe. Vaccines are safe. Vaccines are safe, okay? Get your children vaccinated. Do your research. If you think it's too much, spread the vaccines out, but still get them vaccinated. If you don't trust getting at a hospital, go to a CVS, go to a Walgreens, go to your pediatrician. They might have a little clinic there instead of getting it done at the public hospital, because remember, we want to keep our kids safe around sick people, people with coughing, with a fever. We just want to keep them safe. So 6 months or older, try to get your children vaccine. So therefore, all children should be vaccinated, and if possible, because of not vaccinating your child, puts other children at risk or harmful or death due to preventable diseases. Okay, guys, tell me what you think about my video. Bye.